things in this thing that you say that make a whole lot of sense, but the whole thing becomes kind of moot when, if you're going to put business against government, it's just flat not going to work. Anytime that you can provide a product to somebody that costs less than what it costs to produce it, everybody's going to go to the government program. And then all of the things like pulling the plug on grandma that everybody's talking about, or ration healthcare, those things all become a reality. Because if we're into a government program, they can't produce enough stuff to get everything done.
Sir, we need to get to a lot of questions. So,
those are good points, Mark, and believe me, this is a very, very complex issue. And one of the reasons why we have been bringing in experts on healthcare policy, healthcare funding, and having them talk about how you change the current system, which most people agree is not working as well as it should. Because we still have way too many people without access to primary care. We still have way too many people that don't get the type of insurance they want or staying in jobs they don't like. So what we're trying to do is to bring about a comprehensive change in the way we look at healthcare delivery in this country. Now, the people that are charged with looking at the overall impact of what we're doing is the Congressional Budget Office. And believe me, they're very difficult to deal with because they won't recognize savings for preventative care and wellness because it's spread out over too long of a time. A lot of us happen to think when you look at 70 cents of every healthcare dollar being spent on chronic disease, that may be the biggest way we can save costs is by teaching kids what they need to know not to have so many obese kids running around and having these lifetime healthcare problems that we all end up paying for. But when we deal with the CBO, they're not giving us credit for that because it goes over too long of a period of time, and we're looking at a 10-year bill. So I know it's frustrating, but one of the things we're trying to do is help small business owners. Because right now, I talk to a lot of small business owners, healthcare costs are one of the huge obstacles to hiring more workforce, improving productivity, and competing in a global marketplace. So that's why it's not, there's some people that have a healthcare plan that they love, they want to keep. Nothing is going to force them to change that. And if you look at what's happening right now, a lot of those companies that have a choice and could be doing things differently with their healthcare are still offering what would be called a premium plus plan because they want to attract the highest quality of employees. So I'm sorry, I happen to disagree with people who say there's going to be a mad rush to the public health insurance plan just because it's a public plan. If that happens,
it'll be less expensive.
Well, if it's less expensive, it's because it's eliminating some of those loading fees. Because the rest of it has to be based on the same actuarial principle.
Then all the other insurance companies go away.
Let's let the congressman answer the question. I apologize, folks. We will continue to address these, but once you ask your question.
I disagree with that, and I'll tell you why. One of the companies that's here on my list is Aetna, and their CEO was one of the witnesses who came and testified. He gets $23 million a year. But you know what he said? He said, we think we are going to be competitive in this new health insurance exchange. And the reason why is because they're used to having to change their business model to deal with changing circumstances. They think that they can bring in highly trained employees, bring more efficiencies to the operation of the federal government, and still be a competitive player. That's not my words, those are his. And I realize that people are skeptical.